Hello, and welcome to the Texas Rex Educational Series. This session is being recorded and will be posted on the texasrex.org webinars page if you want to review the content or share the information with your friends and colleagues. Our speaker today, Sheila Banyai, will be speaking about security risk assessments, why they are done, and what should be covered. All attendees have been muted to block out background noise. If you have questions for our speaker, please post them in the chat block of the GoToWebinar page. Your questions will be read to the presenter at the end of the presentation. If we are unable to answer your question during the allotted time, you will receive an answer via email. First, some information about our speaker. Sheila Banyai works for the Gulf Coast Regional Extension Center as a Health Information Technology Consultant, as well as the Security Risk Analysis Lead. Sheila assists practices in the Houston area to achieve meaningful use and attests for the EHR incentive program. She also does the risk analysis and provides the SRA reports for all the critical access hospitals and rural hospitals in the Gulf Coast region, along with her own practices. Sheila has 3 years of healthcare experience and more than 20 years of digital communications experience. Sheila holds a bachelor's degree in computer engineering, the GIAC Security Essentials certification, and the Certified Healthcare Technology Specialist credential. Thank you for joining us, and I will now turn over the webinar to Sheila. Sheila, the presentation is yours.
Thank you very much, Veronica, and hello, everyone. As Veronica said, I have been doing SRAs for 3 years now. I have completed SRA reports for healthcare facilities of all sizes, from small one-doctor practices up to 110-doctor organization with 20 offices, and also critical access and rural hospitals. No matter what the size of the facility, the goal is the same, to keep your patient's information safe. Security has been capturing the headlines lately. Oops, back up. Let me start over. Security has been capturing the headlines lately. Fines are being handed out because PHI is compromised when unencrypted laptops are stolen. Providers are being required to return their EHR incentives because SRAs were not completed annually, either before or during the EHR reporting period. But I'm not here to scare you. I'm here to educate you on how to correctly perform an SRA. So what does the SRA stand for? Is it security risk assessment or security risk analysis? Let's take a look at the definitions to try and decide. Security risk analysis is defining a risk and is identifying a risk and defining a countermeasure to keep that risk contained. Risk assessment is assigning a value to a risk either in terms of money or time. Does it really matter if we are doing a security risk assessment or security risk analysis? Not really. Both are done during the never-ending process of an SRA. Why do I say never-ending? Well, let's take a look at the process. First, you identify the risk. You don't necessarily need fancy, expensive equipment for this. Although as your network grows in size and complexity, the need for fancy, expensive equipment grows in necessity. But let's keep it simple. Let's pretend that we are a small practice and we're just thinking through the risk. Think of how your network flows. Think of your network and how the data flows through it. Are there enough barriers to block any data that wants to cause harm to your network? Do you have firewalls? Are they placed properly? Do you have antivirus on all of your computers and servers? Is it automatically updated? Think of your equipment. Is it approaching the end of its life? Is your server about to run out of memory or disk space? Are your computers so slow that your people have threatened to use them as boat anchors? Think of your software. Has your EHR been upgraded to the 2014 certified version? Is your antivirus up for renewal? Is your wireless router running on an outdated encryption algorithm, which means it would need to have its software updated or the unit be replaced? Do you still have XP machines in your network? Think of your people. Are there policies to define the proper use of your equipment? Have your people been trained in the proper use of your equipment? Has your equipment been configured so that it blocks them from administrative functions? Are there sanctions in place for those that cause harm to your network, either on purpose or by accident? Think of your physical space. Are your servers and network equipment in a place that is not easily accessible? Is that space dry and cool? Think of disasters. What would happen to your data and your equipment in case of a fire, flood, hurricane, tornado, or power outage? You're not on your own. There is a tool to help you to identify your risk and help you through the complete SRA process. I will tell you more about this tool later. The next step would be to decide how to handle those risks. Are you going to eliminate the risk or bring it down to an acceptable level? For instance, the only way to really secure your network is to cut it off from the internet and stop your people from using their computers. While you will never have your data corrupted from a virus again, you will never get any work done either. Risk management is a balancing act with security weighing against usability and money. You are the only one who can decide which way the scales will tip for your facility, security or usability. So in this step, for each risk, you would decide to accept the risk or define a countermeasure that will eliminate the risk or bring it down to a level you can live with. Then the risks are prioritized. Which one poses the greatest threat to your network? The priority assigned to the risk would have nothing to do with money or time. The first risk to be mitigated would be the one that has the greatest potential to affect your data. Remember, the chief concern here is to keep your patient's data intact and secure. Then the countermeasures are put into place. Please take time to plan this step in detail. Changes in your network are going to affect every person using your network and all of your patients. Make sure that every department is involved in this step and everyone is aware of the changes that are going to happen. Then you monitor the network to make sure the changes have the desired effect. Ensure that in the planning stage you have a backup plan just in case the changes cause unforeseen or undesirable effects. The backup plan will help you to return your network to the original working configuration. Now do it all over again. See? Never-ending process. There are always going to be new threats that have to be addressed. You have valuable data in your network. The credit card data by itself is a big lure to hackers. If you add in the revenue that can be generated from false claims with the Medicaid or Medicare numbers, it sends the hackers into a feeding frenzy. So if this is a cyclic process, just how often do we have to start each cycle? To be eligible for EHR incentives, an SRA must be completed annually. This does not mean that the entire process has to be completed each year. The SRA can either be a complete SRA or a review. How do you decide? A good place would be to start answering the following questions. Have you changed your network? Have you upgraded your router? Changed your internet provider? Expanded your network with new switches? Have your telephones gone digital? Have you moved to a different office? Have you added an office or maybe closed one down? Have you changed your IT support or have you gone with a different EHR vendor? If the answer is yes to any of these questions, you must do an entire process all over again. A complete SRA is required. If the answer is no to all of these questions, then a review is acceptable. We have covered the steps for a complete SRA. Now we will discuss what needs to be done in a review. When you did the original SRA, you made a list of risks. I suggest that you keep your risk in a spreadsheet or some other kind of living document that will allow you to keep track of the status of each risk over an extended period of time, because it might take years to mitigate a risk down to an acceptable level. Remember, this is a never-ending process. So the first step is to review your risk list. But before you review the list from last year, take a look at the current security environment. Have there been any new threats identified that pose a risk to your network? For instance, Microsoft no longer supports XP. All XP machines should be removed from your network. If you have software that you cannot update that requires XP, keep the XP machine isolated from the internet. Other things would be, has your server been throwing errors? Do you need to replace or upgrade it? Or has the AC in your equipment closet stopped blowing cold air? Is it time to have it serviced or replaced? Any new threat should be added to your risk list. Now that you have a current risk list, we need to decide which risks you're going to tackle this year. But before we move on, I need to make something clear. The risk list is a living document. Do not wait an entire year to add risk to it. As the security environment changes, your risk list should be updated to encompass risks that have the potential to affect your network and your data. Okay, let's move on. So now you mitigate or eliminate as many risks as you can this year. Remember to update your risk list as actions are taken. If it's not possible to complete the action for that particular risk this year, update the status. The SRA is required every year. If you are not able to get everything done this year, there's always next year. However, remember that there's a good chance you will be audited and you're going to have to explain your actions. Make sure your reasons are justifiable for accepting a risk or for putting off any actions to eliminate or lessen a risk. There are two actions that you should be taking every year. Review all your privacy and security policies and procedures and update them as necessary to keep them in line with your current workflows. All of your people should receive security training every year. They should be reminded what to do and what not to do to keep your network safe and your patients' data unmolested. So what are the topics or areas that should be covered in an SRA? This list might look familiar. I don't believe in reinventing the wheel, so I've taken all of these topics off of the ONC Security Risk Tool. I will give quick suggestions for each topic. Your Texas Rex will be more than happy to discuss all of these topics in detail with you. The topics are security program. You must have one person identified as a central point of contact for security coordination. This person can be the head of a team of people, but someone has to be in charge. In addition, you should have a signed BAA, that's a Business Associates Agreement, with each of your business associates. Remember that the Omnibus Rule changed the definition of business associate and covered entities. So you're going to want to make sure that your BAA is in accordance with the Omnibus Rule. Security policy. You should have a full set of policies and procedures that cover all aspects of privacy and security. If you choose to purchase a template, be sure and update the policies and procedures to reflect the workflow of your organization. An auditor is going to evaluate your organization on how closely your people follow these written documents. Risk management. We've already discussed the steps for risk assessment or analysis. This process, along with keeping track of your risk and the process of mitigate them, is risk management. Training and awareness. Make sure your people are given training on security topics on a regular basis and that this training is documented. Personal security. Are you doing background checks and reference checks before you hire anyone? Are you checking the references of a contractor before doing business with them? Physical security. Do you have locks on your equipment room door? Is there a lockable door between your waiting room and exam rooms? Network security. Do you have firewalls and antivirus? Are your hard drives encrypted? Encryption is a hot topic with CMS and ONC, and it just makes good sense. Encryption is the most effective way to protect your patient's data either at rest or in transit. Now, for those who are not technically inclined, let me explain what I just said. Data at rest is when it's stored on a hard drive, USB, or some other kind of electronic storage device. Data in transit is when it's being emailed or transmitted electronically. Encryption is making the data unusable to anybody but the intended recipient. For example, think of a World War II movie. Remember how the Allies were always trying to break the Germans' code? They were trying to break the Germans' encryption so they could read the message. There is software that will encrypt your hard drives. Your IT support can help you there, and as always, your recs are here to help. I recommend that all of your computers have their hard drives encrypted, but most especially your laptops. Please do not let your laptops leave your facility unless the hard drives have been encrypted. They are just too easily stolen. If your laptop was encrypted and is stolen, the chances of you being held legally liable for any compromised PHI is greatly reduced. Logical access. Are your user IDs unique? Do you have a policy against sharing logins and passwords? Operations management. When PHI is emailed, is it encrypted? Are you disposing of your computer equipment properly? Are you monitoring your network? Do you review the access logs on your firewall and EHR? Incident management. What is the procedure when a security incident does happen? It's not a matter of if, it's a matter of when. The Omnibus rules change the requirements here as well. Texas House Bill 300 strengthened the requirements for incident reporting. Make sure your policy for security incident reporting follows both Omnibus and House Bill 300. So what is a security incident? Whenever someone outside of your organization gets unauthorized access to your patient's data, or if you suspect someone has had unauthorized access to your patient's data, it is a security incident. For example, sending a referral to the wrong doctor, or leaving your laptop at Starbucks, or a hacker has gained access to your network. These are all security incidents, and all of them need to be investigated by your organization to determine if the incident needs to be reported to Health and Human Services. Business continuity management. What would you do in case of a disaster? How do you back up your data? The purpose of this section is to ensure that no matter what happens, fire, flood, or locust invasion, you will be able to set up shop somewhere else and have access to your medical records so you can see your patients. All of these sections should be addressed in your SRA. Now as to something to help you. ONC, HIPAA, and OCR recently collaborated on a risk assessment tool. You can find it by searching the internet for ONC Risk Assessment Tool. Using this tool and making a good faith effort in utilizing the tool will ensure that you meet the requirements for the HIPAA security rule and for the EHR incentive program. If you feel overwhelmed when using the tool and decide to reach out to the RECs or some other party, please stay involved in the SRA process. If your people understand why the security rules are in place, they will be less likely to try and circumvent them. So who's required to do an SRA? All providers who take part in the EHR incentive program, along with all organizations that handle and process PHI, basically everybody in healthcare. Please remember that the goal here is not to annoy you or take you away from the very important job of treating your patients. The goal here is to keep your patients' information safe. Okay, that's the end. Thank you very much for your attention during this presentation. Are there any questions or comments?
Thank you, Sheila. Sheila, there's a question. How do I encrypt my hardware?
There's software that you can purchase, install on your hardware that will encrypt the hardware for you.
Okay.
We really can't endorse one piece of software over the other. If you go online and type in encrypting hardware, you will get a whole lot of applications or software that will do this for you. There's everything from free to hundreds of dollars. You know, if you get free, you get what you pay for. So this is something that you and your IT people are going to have to decide on how to handle it.
Okay. Thank you, Sheila. There's another question. Do you have a policy and procedure for review if data gets compromised? What do you do?
Do I have a policy procedure for review, and what was the second half?
If the data gets compromised.
There is an ONC template that you can use for policies and procedures. I know that TMA also has a template. Again, though, you want to modify the template to make sure that it matches what your office actually does. Did I answer the question?
Yes, I can wait to see if they have more questions. There's another one. Regarding encryption, will this be only for the laptops and not servers?
Okay. Everything should be encrypted. Your IT people might tell you that if you encrypt your server, it would make replacing information hard if you were to if your hard drive was to malfunction. I talked about a balancing act. This is part of the balancing act. So if you don't want to encrypt your entire hard drive, please make sure that the database for your EHR software is encrypted, and most of them are. But get that in writing from your EHR vendor that their database is encrypted, so at least that's on your server. Desktops, it's better to have them encrypted because desktops can get stolen just as much as laptops can, but laptops, yes, have them encrypted.
Okay. Thank you, Sheila. There's another one. What about cloud-based services? How do I confirm that they are secure?
That's a question to ask them. How do you keep my data secure? What measures do you take to keep my data secure? Is it going to be, is the hard drive encrypted where it's stored? Are there two places where my data is stored so that if a natural disaster happens at one place, you can still get data at the other? How often is the data backed up? I can't think of anything else. But this should be part of your contract. It should be in a small print of your contract how your data is handled with cloud-based providers.
Okay, thank you. Another one. Can you give specific ideas of what to do if laptops get stolen?
Okay, if that would be a security incident, and every security incident needs to be investigated. So you bring your team together, or if it's a small office, you and the office manager sit down and list what was on that laptop. Was it encrypted? How much patient data was on that laptop? If there was more than 500 people's worth of patient data on that laptop, it needs to be reported to Health and Human Services immediately. Anybody that you know of that patient data was on the laptop, you need to tell them. There is a set of rules that you can find on the ONC website that will help you through the process of investigating a security incident.
Thank you. And let me see, there's another one. If your system is set up that the laptops or desktops only access the data via remote desktop session, does that allow for laptops and desktops from needing the encryption software?
Okay, kinda. But take a good look at your system. Is there any way that, like for a report or a Word document, could that have patient information on it? I understand that all the clinical data is held in the EHR and that's held off-site. But make sure that no notes are stored on the hard drive of your computer. And if that's true, then no, it doesn't need to be encrypted.
Okay, thank you. Another one. Can you give some specific examples or ideas as to what situation should trigger a security incident?
You know, it's very, very broad. Whenever I mention that whenever you're referring a patient, you send the documents to the wrong doctor. That's a security incident because someone has your patient's information that you didn't intend to get. So, but that doesn't need to be reported. The investigation could be calling up the doctor that the documents were sent to and saying, please destroy those documents. Either put them in the shred box or delete them from your fax, destroy them. And since it's a medical facility, you can be almost guaranteed that they will handle the patient's information properly and nothing's going to be done. You have done your due diligence, you're good. If your software starts acting funny and you think that maybe there's a hacker in your network, you call your IT and ask them, can you help me find out if this is true or false? That gets a little dicey, and there you would need to go to the ONC and walk through the process that they give you. It depends on what has happened as to the steps you take and as to the steps you take.
Okay. Thank you. And another one. Encryption can be a risk in itself. Diligence must be taken, and I will contact an IT security specialist before attempting. He's
right, or whoever that is correct. Encryption can be a risk. If you encrypt an email as it goes through your network, the software that monitors your network can't tell what's inside it. This is a way that hacker gets their information in and out of your network. Definitely talk to your IT provider. Think about all the risks before you do anything.
Okay, and those are all the questions I have. So, another one, I'm sorry. Do you have a sample of an agreement that should be signed by business admin agreement?
There are several examples that you can find on the internet. AMA has one, ONC has one. Some of them you have to pay for. And answer the question, yeah, I believe all the RECs have examples.
Okay. Thank you very much, Sheila. We're going to give a mini advertisement. Carson Scott from West Texas Regional Extension Center is going to talk about the services we offer. Carson, are you there?
Yeah, I just wanted to speak just a couple minutes to everyone on the call. I'm with the West Texas Regional Extension Center, and Sheila, obviously, with Gulf Coast. There's 4 regional extension centers in Texas. And so we serve the 108 most western counties of Texas, geographically about half the state of Texas. So if you fall in to one of those counties, then you'd be receiving service from us. And so just wanted to let you know we're a program of Texas Tech Health Science Center. We're opposite out of Lubbock. We've served about over 1,400 PCPs, serve about 60 hospitals, and a growing population of specialists as well. So we really do provide services to any provider or hospital that exists out there. We have a few different agreements that different providers fall under with our consulting services. And you can see here on the screen, provide services with meaningful use gap analysis, incentive audit preparedness, Medicaid, Medicare, incentive payment registration attestation support, and then all the privacy security best practices, SRA, all the kind of stuff that Sheila just talked about. We can help guide you through that. Stage 1 and Stage 2 of meaningful use. Some of you guys are there. Project management, workflow mapping, redesign, help with health information exchange. We all know there's a lot going on with that in Texas right now. And there's some questions to be answered in the white space, which falls primarily in West Texas. So we're working with THSA on that. Patient-centered medical home support, ACO support. We've just added ICD-10 transition. We know that it got pushed back till next year, but there's a lot of work to be done on that, so we can definitely help you there. And something else we're pretty excited about is we're working more closely with telemedicine and Texas Resource Center that comes out of our Rural and Community Health Department at Texas Tech. And so we're able to provide those services as well if there's something you feel we can do with telemedicine or any of these services listed on here. Just feel free to give me a call, Carson Scott directly. Our number's up there, and that'll get to me. I'd be glad to answer any of your questions. We do have a couple different program options that are available depending on what you fall under. With Medicaid, if you happen to be a specialty physician out there providing services and you have more than a 30% Medicaid population, and that includes Medicaid as secondary, group volume, all those kind of things, we are funded through the state to provide that service at absolutely no charge. So if you are a specialist and you serve Medicaid, give us a call and we'll see if you kind of hit that. Otherwise, we have some contract options that are available for anyone out there, specialists, PCPs, hospitals, whatnot. All these services fall under the same agreement, so it gives you the option to really pick and choose what you need. So if there are any questions about our services or what we do or who we serve, I'd be glad to answer those right now. Otherwise, please give us a call up there at the number on the screen or by email, and I'll actually read that email addresses there as well. So thank you.
Thank you, Carson. Actually, yes, I have two persons that are asking what is the cost.
Okay. So if you're eligible for the Medicaid program, there's no charge. If not, we have two options under our healthcare organization agreement. One is it's $175 an hour, and that allows you to basically kind of pick and choose the services you want. For clients that sign up for that, you don't owe the Regional Extension Center anything at all when you sign up. It's completely based on your decision of what you want and when you need it. So you can sign up with a contract with us and basically have us on retainer, and you are a client active, and then you can, like I said, use that service as you wish. Or we have service options where you can purchase a block of hours, and the more hours you purchase, the cheaper it gets. So the smallest option would be to purchase 15 hours, and those hours should be good for a 2-year period. And so with those, for example, 15 hours, that turns out to be $2,550. And the way that works is you would pay half that amount when you sign up, and then you would pay half of the remaining amount whenever you completed those 15 hours. So that's just kind of an example how that works. Like I said, those will get cheaper as you buy more, or if you do the hourly option, you just kind of pay as you go, and and choose what you need there.
Okay. Thank you very much.
There's another question?
No, those are the only ones I have, and they're asking for the cost.
Oh, okay.
Thank you.
Sure.
Okay, well, now I just want to thank our speakers for taking the time out of their busy day to share their knowledge with us. If you have any questions for today's presenter, please email Texas Rec using the email shown, and we will make sure you get an answer. Please join us next month for our next educational webinar in the series. We'll be presenting practice project planning, how to devise and implement project plan. It's going to be on September the 3rd, and I hope to see you there. Thank you, everyone, for attending today's webinar. That's it. Thank you. Goodbye.